Well, you can get the information off our website. We can send you a leaflet which explains how to do it, or you can look on the internet. There's lots of help out there telling you how to do them. The main thing is you need to be able, for ladies, to focus on the vaginal muscles, and for men you focus on the anus muscle. Now the problem is a lot of ladies can't find the pelvic floor and they can't find the vaginal muscles. The damage might be so bad they can't clench those muscles, or they might just not be aware of their anatomy and how to engage in them, doing them properly. So try at home yourself, but if you can't do them, go and get some help. Go and see your GP, he can examine the vaginal muscles, or go and see the practice nurse if you've got one of those, and they can go through with you how to do the exercises properly. So the way to do them when you're first learning is you need to sit in a comfortable chair. You can eventually do them standing, sitting, lying, in bed, at the kitchen sink, anywhere, anytime you can do them. You don't need to set a time specially aside to do them, which is a lot of ladies haven't got time to do pelvic floor exercises, but I'm doing them now sitting here, and nobody need know that you're doing them. So anywhere, anytime. But the most important thing is try and attach it to something you do every day, and then you'll remember to do them. So if you sit down and have 3 meals a day, do the exercises then. If you're in the car every day, do them every time you stop at a traffic light or at a roundabout. Pop a little post-it note on the dashboard to remind you to do them. So make it part of your routine. When you're cleaning your teeth, do the exercises then. But when you first learn, you need to concentrate. So sit on a firm chair, and you're going to relax everything, breathe normally, and focus on the anus muscle for men and the vaginal muscle for ladies. Sometimes it's easier to lean forward slightly so you can feel the entrance to the vagina on the chair. It just helps you find the bit you need to squeeze, and you're going to squeeze and lift those pelvic floor muscles off the chair. So it's a squeezing together and a lifting motion. But when you do the squeezes, it's really important you don't hold your breath, because it's automatic when you tighten to hold your breath, but you don't. You keep breathing normally, relax everything, don't tighten the tummy muscles. A lot of ladies tighten up the tummy or tighten up the thighs. That doesn't work. Nothing should move on the outside, because it's just the internal muscles. And you're going to squeeze and lift and hold it for as long as you can. You're aiming to be able to hold for about 10 seconds, but most people when they first start off can perhaps only hold for 2 or 3. Then the muscle fades away because it's too weak. So it takes practice and perseverance. You need to do 10 squeezes each time, 3 times a day. You do 5, then rest for a few seconds to let the blood back into the muscle, then do another 5. So 10 squeezes 3 times a day, but ladies need to do them every day for life, especially if you've had children or constipation or got weak pelvic floor muscles. You need to do them every day, because it's like any muscle. If you don't use it, you lose it. And if you forget to do them for 6-8 weeks, you're back to square one and you've got to start from scratch. So build it into your daily routine. Do them every day. If they're not working, it takes about 3 months to get those muscles. Depends what you're starting from, but if you're starting with very older, weaker muscles, it can take up to 3 months. If nothing's working, then get a referral to see a continence nurse or to a physiotherapist who will check that you're doing them correctly, and also give you, sometimes ladies need a little individualised program. Some ladies can only contract one half of the pelvic floor, not the other, from damage from giving birth. So the physio can check that out, check the ligaments, the muscles, and give you an individual program and help you back with biofeedback machines and things to make sure you're doing them properly. So you can see somebody on the health service, or you can pay to see somebody privately.